am Dr. Gunadhar. I am from Apollo Hospital, Navi Mumbai, the working intensivist. So as we go ahead further, this is a session which enlighten us basically what is the lack and what is the deficiency in the present curriculum of the your courses and how we can improve it basically. So this is some of the statistic that is on the worldwide. So if you see, there are a lot of published data from the, there are a lot of research and the public data which says that India is deficient in number of, is the number of registered dietitian compares. So they say almost we require 3 lakhs to 5 lakhs dietitians till now to fill the gap basically. If you see in our neighboring countries like Nepal and the Sri Lanka also have been more number of dietitian to your what is called the population ratio. And if you see the critical care dietitian, basically their numbers are still less, very, very less, almost in the range of 0.032 per per ICU, or you can say per 1,000 of your patients. So which is very, very less presently. So I just want to ask why this is so basically. So what is the gap and how we can need to fill the gap? So madam, can you just enlighten us? What is the problem? Why the India has like so many less dietitians and what is the deficiency?
Very good morning to all of you, and at the onset I would like to thank the as Dr. Ravin already mentioned, that he is the angel godmother, and thank you for this 6th edition of Nutrition Boot Camp, which keeps us going and sensitizing us in the area of critical care and nutrition. And as rightly you have asked, it is not only the critical care dietitians, but all over we are in shortage. First of all, there are less number of universities giving nutrition courses. Also, there are, because of many other reasons, this is mainly a female-oriented profession, and not many continue in the profession once they take up these studies in nutrition. That is also on one area. And if you speak about the critical care, we do not have a specialized critical care nutrition courses, and that's why also not many people will take it. Also, if I may say that on the part of the medical fraternity also is not given that much of accreditation to the critical care specializations. And on our part, yes, we need a dedicated critical care dietitian. We need commitment. We need a lot of patience to come forward and work in these areas. So government, if I say the policies, the regulations is also one reason for this.
Good morning to everyone. At the outset, thank you, Dr. Sanjeev, for making us a part of this nutrition boot camp. It's really, really nice to connect with the fraternity, and a very relevant session. Responding to your question, let me put it that 10 years back, I was worried that we don't have credible nutritionists in this country, because anybody doing a 2 months or a 3 months course would claim to be a nutritionist. But a decade later today, I am pretty much convinced that there are huge number of students who've undergone credible training, and when I say credible training, it's an investment of minimum 12 years in this field. So you say a 3 years of graduation, a 2 years of post-graduation, and maybe a 3 to 5 years of PhD. So investing that kind of time in the field of food, nutrition, and dietetics is definitely going to lead to these quality professionals. Yes, I agree with what Ms. Benjamin said, that we still do not have those many institutions who are offering this kind of credible training. And one of the reasons is that, you know, nutrition as a subject started with Faculty of Home Science, yeah? And that's how, you know, the whole misnomer was that, you know, it's only for women. But if you look at, the world globally, a lot of nutrition scientists are men. And today, again, the scenario has changed. And there are universities wherein men are also enrolling for nutrition. So the demand for this discipline is increasing, and with the demand increasing, a lot of universities are taking up this, as a program to be offered. But still, we have a long way to go, and one of the things which we really have to overcome is the heterogeneity in the training. And when you say training, it is the content, it is the teaching methodology, it is the hands-on experience. So teaching is an experience which you give to the student. It is not the same across India. And I'm very heartened today, friends, that, we have the National Allied Healthcare Professional Bill, which has been passed by the Government of India. It's a GR today. And I think very shortly, there would be a steering committee at the center, followed by state committees. And the first thing this council is going to do, which has incorporated nutritionists as one of the allied healthcare professionals, this council would do is to get this homogeneity, in this training. Because unless and until we do that, we can never raise the bar. But yes, I go back to my statement that today I'm not worried about quacks, because I know so many of our kids are already in the space doing credible work. And one more thing which I want to add here is that pandemic, I think, made a huge change in the whole scenario of education, which I always envisaged, that, the future of this education in this country is the virtual education. You can't have the experts reach every nook and corner of this country. But through virtual mode, pandemic has taught us that we have connected with every student who wants to get trained in the field of nutrition in this country. So I think the future is very bright. And no sooner, I know I'm looking at those figures of the number of dietitians with the population, but I think 5 years down the line, the scenario is going to change. Yeah.
Yeah, that's a very good news actually, and hope so. And madam, what can you do to increase more and more male dietitian in the our curriculum? Because that is one of the.
Sorry?
What can you do more to include more and more male dietitian in our curriculum, ma'am?
No, I don't think so. In 21st century, we are really talking about males and females. Okay, we are talking about professionals. So I think gone are the days, when we are talking that language. So all of us should think about this, yeah.
Yeah. So hopefully, I think this definitely very good news for everybody, because we are struggling with this acute lack of this registered dietitians, and it definitely is going to fill the gap. And yeah. So the next slide, basically, this is just not to show all these celebrities. So my aim is to show that everybody can excel in their career, like Amitabh Bachchan, like Sachin Tendulkar, like all our doctors' friend, like some of the surgeons, budding surgeon, intensivist. So what is basically the excellent career opportunity for the dietitian now? Because we feel the sky is the limit. What do you feel, ma'am?
Yeah, I think I go back to my statement that the excellence comes with training, credible training. And when you say credible training, it has to start with a robust curriculum. It has to start with a vision to develop that robust curriculum, customized to where that curriculum is going to be offered. I mean, today I can't pick a Western book and say that I will frame an Indian curriculum based on that Western literature. No, I may get a reference from there, but I'm going to customize it to what I see in Indian scenario. So my clinical care standards, whatever case studies I'm going to teach my students, have to gel, have to synchronize with what kind of patients do I see in India, which I will not get in any Western reference. So starting from developing a curriculum, and today, as academicians, and people who have invested 3 decades in this field, today we are talking about a learning outcome-based curriculum. So I'm questioning myself every time I write something in the curriculum, that what do I expect this child to be learning after I give this as a part of the curriculum. So it's completely becoming learner-centric, learning outcome-based, more precise, more focused, and this has to be related to the way I'm going to evaluate. First is how I'm going to teach this. So there is a curriculum, there is a focus in terms of the learning outcomes, there is a focus in terms of what teaching methodology I use, there is a focus in terms of how I'm going to evaluate the student. So if this is the kind of precise work we are going to do in developing a curriculum, I'm sure excellence, is not far. But this is not happening across India. So today, I am very proud to say that I am spearheading a very prestigious autonomous college, which is Sir Vithaldas Thackeray College of Home Science. It's of SNDT Women's University. And it was the first autonomous college of Maharashtra. And we are celebrating 25 years of autonomy, with this status. So I can see that, we could raise the bar in terms of our curriculum, in terms of our training, and get that academic excellence. But time is not far off. I can see a lot of other colleges also investing that kind of energy. And today, I think with the new education policy, it's becoming a mandate for every education to, institution to look and introspect as to what they're offering and what kind of template is it. So I feel, so starting Mantra for Excellence is a credible training, credible faculty, and I think today there is a lot of focus on experiential learning. So gone are the days when we are only sitting in the classrooms and learning, So I think you can just give to the students ahead of time what you're going to talk in the classroom, and rather invite them for a dialogue, in a session, or take them on a clinical setting and do a hands-on kind of a discussion. I think that's the way we are going to get more credible people in this profession. So training and, good faculty, good teaching methodology, I think these are the mantra for excellence.
Yeah. Thank you, absolutely true.
Just to end what Dr. Madan has said, to this August gathering, I would say that it is evidence-based good nutrition practice is what we are looking at, and not only the dietitians, but it's the team effort with the intensivists and the treating surgeons and the medical fraternity, that we must come together and look for, and each individual patient, the outcome-based learning. So not only the dietitian puts in the effort, but it's the learning for the entire team, and that is where we looking at the excellence in practice. And I'm sure all sitting here will agree to that, and we are trying to achieve this in each individual intensive care.
Yes, absolutely, ma'am. So I just want to know, and all of my, of course, all the dietitians who are sitting here, they wanted to know what are the different options beyond the registered dietitians. What can the other career path they can adopt beyond the registered dietitians?
So registration, RD is actually globally it is accepted that you should be a registered dietitian and nutritionist. And we as an Indian Dietetic Association have started conducting the exam and giving the hands-on 6 months extensive internship in the area, where the rotation of critical care is also included. Though we are not able to give enough time, but it is quite structured program where we are giving credibility and giving them hands-on experience in this area. Other areas, if you are looking at, as Madam has already said, that 3 months, 6 months courses by associations and different societies is definitely not acceptable. What I would say, and what I've been saying when we had a Dr. Oak as a dean, and he used to always say, ma'am, write to the chancellor that nutrition course should start in a medical institution. That is going to give a credibility like occupation therapy, physical therapy, that and they will be at par excellence with other team members, and that is the need of the
Yeah.
hour
So,
today.
yeah, absolutely. So, ma'am, basically, what I am focused at basically about the critical care nutrition or any certification courses or any diplomas, it presently available or any pathway they can adopt to become the critical care dietitian.
Yeah, so I think I'd just like to respond to the question by saying that today is the era of super specialization. Not only specialization, it is super specialization. And we were fortunate, being an autonomous college, we could get into this area a decade back. And today we have a full-fledged master's program in specialized dietetics, where we are giving the choice to the students to pick the specializations, so diabetes and cardiac care nutrition, pediatric nutrition, renal nutrition, and we are going to add more specializations, and critical care nutrition is going to be the next, and even I think GI nutrition. So what I'm trying to say is that getting into the field of clinical nutrition with an edge of a specialization, and within a specialization also giving them a couple of modules which are very, very pertinent, and they need a specialized, supposing it's cancer, so pediatric oncology, or if it is metabolic syndrome, or metabolic health, then, adolescence, so adolescent nutrition or polycystic ovary syndrome, like touching on certain specific areas within a specialization. So that's the way we are following. And to my mind, students should not feel, I think I have so many of them sitting over here who may be also thinking that, if you pick on one specialization and get trained in that, that doesn't mean that you only work in that specialization. Because when you are trained for a specialization, you are always given a foundation, right? So, and the eligibility for such programs is a graduation program wherein a robust foundation has already been, developed for a student. So from there, a student takes off, again builds a foundation, gets into a specialized area, gets into a super specialized area, supports it with a hands-on experience. So that's a huge progress, of getting a professional in that space. But like that, what we are doing is, we are starting a number of certification and fellowship programs. So we already have a module on basic bariatric nutrition. We have a module on advanced bariatric nutrition. And going forward, we are starting 2 more certification and fellowships. One is on specialized bariatric nutrition and fellowship. And also we are starting, IMPACT, that is the interdisciplinary medical and nutrition management of polycystic ovary syndrome. And all this we are doing in collaboration with professional bodies. Like this IMPACT we are doing with Polycystic Ovary, PCO Society of India. Specialized, bariatric nutrition we are doing with OSCE and group of bariatric surgeons and nutrition societies. So I think definitely specialized nutrition is the way forward. And if you specialize in one area, that doesn't mean that's the end of the story, that's the beginning of the story. You could definitely, do a master's program in one specialization, and you can add on a number of these certifications and fellowships to your credit as you go further. Because you never know what kind of job opportunities you get. And I feel the demand for specialized training is going to increase in the years to come. So
Yeah.
definitely,
So
it's
I
a
think
welcome.
this is a very good message for everybody, but in the interest of time, we're just, I'm just going through skipping some of the slides. Regarding the research also, I would like to highlight that India, regarding the nutritional research, India is only contributing 2% of the total research, global research annually. Whereas if you see the United States of America, almost the 26% of the research in the nutrition will come from the US. So this is also one of the lagging area where we need to focus, and we need to improve the research. And last part will be the technologies. So there are a lot of different technologies, like how in the critical care areas, like the tele-ICUs, the simulation-based trainings, and the other trainings have come. So Same thing, the last point of discussion is it going to the future in the, this practice of nutrition? So like the simulation-based or software-based training, can it improve the outcome of the patient and create more and more job opportunities?
So the research is the way forward. And as rightly pointed by Dr. Reddy in the morning, how complicated, how controversial it is. And in India, we are lacking, as we said, the interest in the research in the area of nutrition. Way back, if I say I've been in this career for 45, 50 years, when I wanted to enter into a critical care research within a multi-center international study, our ethical committee did not allow. So there are limitations. The ethical committee of the institutions or whatever, especially in the critical care area, is a limiting factor. But if we come together and if we have a better protocol, I think like Dr. Sanjeet and others are already doing in this area, we can take it forward, and we should be having more of these publications in the area of critical care research and in all over in the nutrition care area. And of course, research methodology is taught nowadays in a master's level in the course. So all of the nutrition students at basic and at the master's level do this course. So they are aware, and they also do the dissertation as a part of their the dissertation in masters and undergraduate. So they are aware. Only thing is we have to come together, make a protocol, and the funds should be available from the government of India and from the institute for these area.
Any message you like to convey?
I just like to add, I think it's a very important question. We do not have, Indian published data for clinical settings. And the reason is, it's not that our dietitians, clinical dietitians are not doing credible work. They're doing huge credible work, but the lacuna is the documentation. The lacuna is the time, because the numbers of patients are too many. There are no facilities to document that data. And somewhere I feel, this is a message which I want to give across to all the stakeholders who are sitting over here, that there is a need in India to create a position of a research dietitian in every hospital. And not one, but there should be a research team in every hospital, so that the person who's spearheading that team is the one who is really trained to brainstorm and identify what are the research questions which are there in my clinical setting. And I think it can start with a simple research question for which you do a simple study, but you do it in such an elegant manner that you can, document it, you can publish it, and make it available to people. And I feel research is never stagnant. It is always a process, it's always flowing. So what you do now leads to another research question which you would like to take further. So to my mind, the mindset of research has to be developed, number one. Number two, you need to be trained to even write research questions. You need to be trained in research methodology, research design, statistics. And because whatever you do, it should be a very, very credible work. Why we are not respected sometimes is because we do not pay attention to the quality which is expected in any research. So I think what Dr. Reddy pointed out, like those were international researchers. So if there can be questions asked for even a randomized control trial, then I think we need to take lessons from there and be very, very focused in terms of what is our research questions, what are our primary outcomes, what are our secondary outcomes, what are the variables. I think the whole plan needs to be developed in a very robust manner, but I again go back to the point that it has to be a collaborative effort. So the academic institutions can come together with the clinical setups and do a credible work. And within the clinical setup, I think we must proactively demand for a research dietitian or a research team which focuses on whatever data is getting collected and builds on the research questions which can be asked and answered and published.
Yeah, thank you, and I really appreciate and thanks both this panelists and all the delegates for this session.
Thank you.
And thank you.